Hello everyone and welcome to our Bioforms Catalyst comprehensive guide to our Catalyst calendars and tools. In this video, we'll explore the tools and features that empower you to stay informed about the Catalyst events that can impact your investments in the biotech and pharmaceutical industries. But first, let's define what is a catalyst. A catalyst is an event that can significantly affect a company's stock price. These events range from crucial data readouts, from clinical trials to the FDA approvals, known as PDUFAs or outcomes or advisory committees. Catalyst outcomes are binary and can influence stock price in a positive or negative fashion. Our FDA calendar provides a list of upcoming catalysts from biotech and pharma companies listed on NASDAQ and the New York Stock Exchange. This is the heart of our website. As you can see, we have more than 1,000 drugs, and the first thing you'll notice is you can type a ticker. Let's say you can write MBAX, and you can find the catalyst related to that, or you can also select the columns that you need. In this case, we can just start adding columns, and you can see those columns are reflected in here. However, if you want to remove some columns as well, you can also do that. The way you do that is just selecting that column in that checkbox, and you'll remove those columns. You can also add it back. In this case, the 30-day price change, which might help you to understand what's the movement over the last month. Then, aside of that, you can always have links to clinicaltrials.gov. And another area where you want to look at is the catalyst date. This is the date that you want to check to get some important news. Always you have different columns, rows, and you can always vote. But you can vote as neutral, bullish. Just don't forget to vote, because this might help like our community to expand and have like a different vision of that. You have also historical likelihood of approval, which is the likelihood that the drug on that specific stage can make it to the end. And in the case of the historical probability of progressing, it's the probability to make it to the next stage. Those are based on historical data from 2017 all the way to 2021. Then you can also use one of our base functions for the FDA calendar and all of our other tools, which is filters. The way you add a filter is you can filter for anything in here. Just press the plus button and you can add by portfolios. So let's say we want to select just the large cap portfolio that we previously created, and as you can see, you have that portfolio here. Or you can always go by just another portfolio, or just select all. As you can see it all in here, and it's showing like the same amount of drugs from the beginning. Then let's do something. Let's give it a try today. So let's say we want to filter for, you want to show all, we want to filter for a stage. Let's say we want latest stage in here. So we want just PDUFAs and probably NDA filing, the ABLA filing, and then phase 3. Then after that, we can also like add more filters in here. So you can add something like, let's do a catalyst date, and I want to be all this way to the end of the year. Then we can add an indication. In this case, let's do Alzheimer and probably obesity, which are trend indications right now. And as you can see, we have 5 drugs on that specific field that they have readouts, or they have a specific PDUFA dates for those days. Then we can also like filter for market cap. So if you want like smaller market cap, you can just get it in here. So if we want like a medium, like a mid cap, or if we want like a small cap, we got it in here. The way you save, you can, if you want just to keep this filter, just save this filter, and then which you can just always go back and see that the filter hasn't changed. However, if you go to reset filters, it will take you all the way back to where you were. You can always select the columns that you prefer, or just see what columns. Let's say if I want to add all the cash information and insider and float, because I think it's important, I can do that, and then just add a specific filter. So I want, I don't know, by stage, let's say phase 1, 1B, and 1.5, and then I just want to save that filter. So you can see the amount of drugs was reduced to almost a third. And then in here, you can just go back to our main page. If you go back to the FDA calendar, so you can see we have these filters in here. So this is a useful tool, and you can apply it universally to any of our other tables that we offer. This is kind of like an overview of the FDA calendar. If you like what you see, just hit us in the comments, or just enjoy Biopharm Catalyst, and happy investments. Thank you.